All right, so the next section, we're going to talk about disseminated intravascular coagulation, or DIC. This is typically a complication of a severe physiologic illness. We might see it with sepsis. We may see it in children or adults with congenital heart disease. We might see it with necrotizing enterocolitis, a rickettsial infection, severe viral infections, amniotic fluid embolus, and cancer. Those are several of the common causes, but it can happen with any severe illness. What happens is, remember that the coagulation process is part of the inflammation process. So this is a, the body is responding as if there is some type of invader or some type of injury that would cause blood loss. So that coagulation process is stimulated abnormally, and usually it's part of the inflammatory response. Okay, thrombin is generated, and that causes clotting throughout the entire vascular system. That can actually cause obstruction and necrosis, which you would expect. But we also have a mechanism to break down those clots. So the fibrinolytic process also is activated, and that causes destruction of those microclots, and we use up all of our clotting factors and cannot clot anymore, and then we start to see hemorrhage. So this is a clotting problem. We're clotting too much, but what we see is bleeding. Okay, so we should expect it. If we have a severely ill patient and they have any kind of unexplained or increased bleeding, we need to suspect DIC and refer that to the provider so they can start managing it. We would see on labs a prolonged PTT, prolonged thrombin time, depressed platelets, fragmented red blood cells, and decreased fibrinogen. Okay. Management, early recognition is key. And as the nurse, you're the one who's going to be there seeing the patient. So early recognition is key. The cause needs to be controlled, so they need to be managing whatever's causing DIC. Platelets and FFP are given to replace clotting factors. If they've lost a lot of blood, then they may get red blood cell transfusions. They used to give heparin pretty routinely because it will stop the clotting cascade to try to kind of let the body catch up. Or let it hold on to some of those clotting factors that are being transfused. But now generally they only do heparin for patients that are not responding to other treatments. So that's not the first line anymore. You get a lot more information about DIC next year. So this is just the basics. Okay. All right. We're going to talk about immunologic disorders next.